Hi, Dr. Larry Altshuler here, talking to you about healthcare and healthcare reform. Telling you things that you won't hear from the media and you certainly won't hear from the politicians. Now, in previous videos, I told you that the Affordable Care Act is going to cost a lot of money, much more than anyone can imagine. And I had two videos telling you exactly why that was going to be. Now, the Affordable Care Act does have some provisions in which it tries to decrease medical care costs. Unfortunately, as we delve into this, you'll find that those provisions will not do that, and in fact, they're going to make our healthcare system even worse. So let's just go into this and find out why. This video is going to have three reasons of why the Affordable Care Act is not going to decrease costs. The first reason, the provision that they have, is called IPAB, which stands for Independent Payment Advisory Board. Now, this board is directed to find ways to slow the growth or slow the cost of Medicare and private insurance. That's one of its main goals. Now, this has already initiated a bunch of controversy in Congress. In fact, there's a bill present in the House of Representatives to try to get rid of IPAB. And there's a reason for this. Now, how can we slow the growth of expenses? Well, in previous videos, I told you about waste, and if we could get rid of that waste and change the system back to a primary care base, that would really save a lot of money. So is the IPAB going to do that? The answer is no. In fact, the IPAB is going to do exactly what the government has always done, and that is simply to decrease reimbursement to medical providers and to hospitals. That is their way of trying to decrease costs, and that's going to backfire. We already have government provisions that do that. We have what's called the Sustained Growth Formula, the SGR, which Congress uses to determine a reimbursement for Medicare. And every year they have to go back and get rid of that and put a temporary provision in so that the doctors don't get such lower reimbursement, they won't see patients. To fix that program is going to cost $525 billion, and no one in Congress wants to do that. It's a real sticky wicket. But here, the IPAB is going to do exactly that, the same thing. They're going to decrease reimbursement across the board. And in fact, President Obama, in his latest budget, has also put in for a decrease in reimbursement. President Obama has decreased Medicare outlays by $500 billion in the Affordable Care Act, but he tells Medicare people, don't worry about it, your premiums won't rise because we're going to decrease reimbursement to medical providers. So on 3 counts, the federal government is going to be decreasing this reimbursement. Now, why isn't this good? Well, number one, it's really not going to decrease cost that much. It's just going to make a little dent in the expenses. But more importantly, right now, doctors hardly make any money on Medicare at all. There's a lot of services that they actually lose money. For that reason, most doctors are not taking very many Medicare patients. And in fact, some doctors and organizations have completely opted out of Medicare. And it's a fine line. Any more decrease in reimbursement, and I guarantee you, most of the doctors are going to either opt out of Medicare or really severely decrease the number of Medicare patients they take or decrease the services they provide those Medicare patients. This is really going to backfire. This is really going to cause a worsening of the quality of care we get, and you'll be lucky if you can even find a doctor to see you if you're Medicare, if the IPAB has its way. So that's number one. Number two way of the Affordable Care Act trying to decrease medical care costs by decreasing drug costs. And that's a huge area. 15% of our healthcare dollar goes to drugs. And the Affordable Care Act for Medicare patients have decreased trade name drugs by 50%, and generics by 7%, and eventually 14%. Well, this will be helpful. But there's one thing that you probably don't know, and that is in the last few years since the Affordable Care Act has been passed, the drug companies have been elevating and increasing the prices of those trade name drugs because they figure that when the Affordable Care Act goes into effect in 2014, they'll have increased the prices enough that they'll still make an incredible amount of profit. So even though the government negotiated this with the drug companies, they're still going to make a lot of money, and drugs are still going to cost a lot of money. We, here in the United States, we pay for 60% of all the drug costs, not just in the U.S., but in the entire world, 60% of the world's cost. Because all these other countries negotiate with drug companies. One example is that statin drugs used for cholesterol. We pay 400% more for each statin drug than any other country in the world. What we need to do is negotiate with the drug companies and decrease the cost like other countries have done. That would save us $300 billion a year. But the Affordable Care Act is afraid to do that. They didn't do that. And by the way, the Republicans are afraid to do that as well. Number 3 on the list, the Affordable Care Act is trying to decrease costs by coming up with programs for chronic disease management. And this is good because 10% of the population actually costs 64% of the revenues. And these are people with chronic medical conditions, especially the elderly. But here's the problem with these programs. They've already been tried. For the last 20 years, chronic disease management programs have been tried. There have been 8 different companies that have been in charge of this. 5 of them have already gone bankrupt by trying to do this. The problem is that the measures that the government has used and the way they're approaching this is totally wrong, and it has failed miserably. The studies have shown that every program has failed. Chronic disease management is a great idea, but it's got to be done correctly, and the government does not do it correctly. And so that also is going to fail miserably. So when you take the IPAB, when you take the problems with drug costs, when you take the problem with chronic disease management, all of those good intentions of the Affordable Care Act, but their solutions are terrible and will not do that, and in fact will not only not decrease medical care costs, but are going to make the quality of care in our health system even worse. Now those are just 3 of the provisions. There are still 2 other provisions, but that is going to be the subject for my next video. So until then, please go to my website, balancedhealing.com. You'll find all these videos, but in addition, you'll find lots and lots of information that will help guide you through the healthcare system and help you find the most cost-effective treatment for your problems. Until then, thanks for listening to me, and I hope you return and watch the other videos. Thank you.